I'm so happy you all made it, especially given the weather. So thank you so much for being here and thank you for your time. Normally, Michael, our regional president, he does a bit more of an introduction, but many of you are actual members and you know what Love.Life is. Hi. And this is a big topic, and I think it's just going to continue to get bigger and bigger. It's funny, when we started the longevity series, we were like, okay, how many people are really interested in learning more about their bodies? And we originally made it with just 20, 30 people on the registrants. And we bumped it up to 70, and it keeps selling out each time. I think what keeps people away, especially over the last couple, has also been a bit of the weather. But we are recording these so that our members will also in the future have some sort of access to be able to catch themselves up to speed. Because there's some things that we talk about, especially in the first couple, I tell some interesting stories, and you never know what comes up. So if you ever wanted to go back, there's also going to be an opportunity for that. So longevity learnings. This is an 8-week series, and I'm here every Wednesday night. The next one is going to be called Menopause 3.0, Redefining Midlife. And then the 26th is hormone replacement therapy, and this is for men and women. I think it's a very controversial topic, so it's important for us to address it. And also, I want everybody to be informed. And there's going to be a lot of education there. I have a few surprises, one of which I'll mention now, and then the other one will be at the end. The first one is that on February 19th, next Wednesday, I'm also bringing in my friend, Dr. Christy Evans. She is the lead head physician at Almond, OBGYN. She is also more in the integrative functional medicine type space as an OBGYN, so I thought it would be a great conversation. So next Wednesday, we'll probably have about 15 minutes on education around what we think menopause should look like at Love.Life. And then we'll have a little bit more of a dialogue back and forth with Dr. Evans, kind of like a fireside chat. And then we're going to open it up to all of you to ask all of your questions. So whether you're asking for yourself or asking for a friend, it'll be really nice to have this container of space. And of course, as always, the Q&A sections are not recorded. So whatever gets asked here stays here, and that's the purpose of you all coming. You have the opportunity to ask different questions, and you will not be on a recording of it. General disclaimer. So informational purposes only. Make sure that you talk to your doctor, your healthcare provider, whoever it is that you're seeing. This is just for information. And for the first two, I never told you guys who I am. I think I was so excited to bring information, and I was like, oh, this is really exciting. Let's talk about mitochondria. Let's talk about aging. And I didn't even actually introduce myself formally. So I'm Dr. Jaclyn Tolentino. I am also a board-certified family physician, and I maintain that certification every 2-3 years. They always have CME in order for us to stay really active and relevant when it comes to being a board-certified family doctor. I've also been practicing for about 15 years. And my training in functional and integrative medicine really comes from the Institute for Functional Medicine. It comes from A4M, the American Academy of Anti-Aging Medicine, and then a few other places where I really found the insightful education, like Datis Karazian and more. I specialize in hormones. Whenever people ask me what do I love to talk about, and when it comes to medicine in general, I think the reason why is because it's so relevant to everybody at every age, and I think that's the purpose of today's conversation, is to kind of walk through women's health through the ages. We all are experiencing hormonal shifts throughout different parts of our life, and not everybody understands those shifts, and maybe people aren't educated on it. So part of that is to make sure that everyone in the community is aware of what happens at different phases, and then what do we do about it? How do we fix it? How do we support it? Are there ways to make things easier for us? Last thing, wow, I skipped through that really quickly, but I am a young breast cancer survivor. So I had breast cancer in my early 30s. My mom is currently dealing with breast cancer. She is 82. She's had 3 cancers at age 48, and again at 68, and now at 82. So that topic, once we get to October and Breast Cancer Awareness Month, I'm going to make sure everybody in this room is very much educated on how I learned about breast health and breast education beyond just the standard self-exam. What kind of tests? What should we be doing? What do we pay attention to? What happens if we have fibrocystic breasts? What happens if we have dense breast tissue? Is there a certain time that we should be going and having our imaging studies done? I will make sure that everybody is very much well aware of what we need to do for that. The next thing, women's health through the ages. It was kind of a strange topic, but the reason why I chose it is because I think it's a good foundational starting place for what's going to happen next. We're going into menopause, we're talking about hormones and hormone replacement and if that applies to people, but let's just make sure we have a good foundation of where it came from and what's going on. So what's a hormone? Can anyone tell me what a hormone is? You hear about it a lot over the past 3 to 5 years. It's probably one of the bigger buzzwords on SEO when you Google wellness medicine. So is there anything that comes to mind when you think about hormones and what they are? And if there's crickets, I'll just take a sip of the green water and tell you. Signals, right? Great, thank you. So chemical messengers that do a ton of things in our bodies. And there are many, many hormones, but there are certain ones that take center stage that we often hear about. So when we think about how hormones change over time, that's the whole premise of today's talk, is I want you to understand that there are lots of hormonal shifts and changes that happen throughout our aging cycles. In this evolution, when you come back to this picture, there's going to be a few things that run through your mind in terms of hormone health. And so I'll make sure that I scroll back so that we can remind ourselves of what exactly shifts are taking place and what exactly happens. So, true statement, your hormones have their own circadian rhythm. And what does that really mean? It means that there are different chemical messengers that are happening at different times of day and night, and they elicit different responses in your body to help you do things. Another true statement, your hormones have their own larger rhythm that sync to aging. People forget about that. We think about the circadian rhythm, we think about our period cycles, but even as we age and get older, certain hormone levels and how they elicit response in the body goes down. And there's reasons for that, so we're going to talk about that as well. I mentioned that there's lots of hormones, but these are some important ones that I like people to be familiar with. So that in the future, when you hear sex hormones, you're thinking about estrogen and progesterone and testosterone. When you think about the adrenal glands that are walnut-sized glands that sit on top of the kidneys, you're thinking about DHEA and cortisol. We always talk about the difference between melatonin and cortisol, so one to help you sleep and one to help elicit a stress response in your body when it needs it. And then there's thyroid hormones. I always think of the thyroid as eliciting like a radar beam to other parts of the body. It's communicating a lot of really important signals. And leptin is an interesting one that I didn't know about in my early training, but I think it's important for people to know about it. This was a really old article, and what's funny about it is that this article first appeared in Vogue way back in 2018. So when I just moved to LA, I was interviewed for this article for Vogue. But interestingly enough, it now has the date of 2023 because the information is still relevant today for all of us, 2018 to 2023. And in this article in particular, we talk specifically about some of the main hormones that you see over here, like the sex hormones. I mentioned cortisol and DHEA. So if you want to read this article, you're welcome to take a photo of this, and this should at least give you access to the full spread where we talk about why these hormones are so important for everybody. I would also argue that even though it says why every 20-something should know more about hormones, this is every 20-something, every 30-something, every 40-something, every 50-something. So it wasn't just about that demographic and that population. They also took this article and they put it in Vogue Singapore, they put it in Vogue Britain. It was all over the place, the exact same article, but it just reminded me how important hormones are and how over the course of multiple years, people are still talking about it. This is just a short list, guys. Like, when I think of why hormones are important, this is probably, let me take a step back because it's an important screenshot to take. Hormones are important for literally everything. And Whenever you think of hormones now, let's not just think about the sex hormones. Let's think about that thyroid gland. Let's think about adrenals. Let's support melatonin and how you sleep. But they're important for everything. And when we talk about hormones, these chemical messengers that have these effects in the body, look at this list. Who doesn't want to make sure that everything on that list is taken care of? I feel like, I do. And even for somebody like myself who's been through breast cancer, it doesn't mean that I don't think hormones are important anymore. I still absolutely do. What you also see is blood sugar regulation. You see blood pressure and fluid balance in the body. People don't commonly talk about that. We focus up here on sexual function and managing stress, but it does so many things, including supporting your brain health and cognition. Hormones. One of the most common statements that's made about hormones is hormones help protect your bones, your brain, and your heart. Very much a true statement. And this is also kind of alluding to why some women feel so strongly about hormones as they age, especially in their 40s and 50s, because we know that naturally these hormones are declining in the body, but they're so beneficial for all these things. As women age, we get osteoporosis and osteopenia, and our bones become brittle, and we get a DEXA scan when we're 65, and it tells us that. But at Love.Life, we don't take that position, right? We want to make sure that people know about these things that are happening in their bodies earlier than that. So we typically are looking at this much, much sooner. In fact, every optimized and medical member at Love.Life is also getting a DEXA scan for that reason, because it's not just telling us about the bones and the bone density, it's also telling us about our body composition, including our lean muscle mass, etc. Differences between the left and right side of your body, if you're holding on to a lot of visceral obesity, etc. So I know that Dr. Anna is going to be going through the dynamics of a DEXA scan and helping everybody understand it on a more finite detail. But just remember that hormones help protect your bones. These chemical messengers do it. They also help protect your brain. They also protect your heart. So when you're thinking about cardiovascular health, like heart disease, cholesterol problems, problems with blood pressure, etc., just think that hormones are also helping to support that too. And since I mentioned there's a rhythmic cycle of hormones, balanced hormones equals homeostasis. That means happy. That means stable. That means restful state. And that's what we're commonly looking for. Think about a lot of women who experience a lot of PMS symptoms or really low hormones. They're not balanced. They're focused so much on these symptoms, and hormones are doing this all of the time. And so because of that, they're out of homeostasis, they're completely not balanced, and they also are experiencing symptoms that go along with it. So I took this picture of Dr. Sarah Gottfried. She is incredible. I really love her. And she also came to Luminescence, which was maybe 2 Saturdays ago now. It was February 1st at the Luminescence event. How many of you went to Luminescence? Oh, nice. Yeah, I loved it. I thought it was an incredible experience. But one thing that she mentioned that was so important is she mentioned this concept here of menopause 3.0, which we're going to be talking about in the next one. But she put this on the screen where she talks about how women starting at age 35, right? I would argue that maybe it's even earlier than that. But all of these symptoms that women experience in perimenopause and menopause, think of those symptoms that are also dedicated to hormonal imbalance. Now, remember that it's not just the sex hormones. It's the adrenal glands and your stress response. It's your blood sugar. It's how well you sleep. And a lot of the symptoms can overlap. And there are also things outside of just hormones that can contribute to some of this. But when you look at this entire picture of hormonal imbalance, how many of us in the room have had 1 or 2 or 3 of these symptoms over the course of a lifetime? I would bet probably everybody has had at least 1 or 2, if not more. And some of you are probably secretly saying, that's like all of those symptoms, but that's okay. And when I think of hormones, these are the changes that you'll commonly see, but that doesn't mean that you can't experience this throughout the course of those multiple decades. So when we go through puberty, we're starting to experience some of these hormonal changes for the first time. We know that. We know in our 20s and 30s, the hormones are also aligned on this monthly cycle, and we have periods. And then in our 40s and 50s, things start to get rocky. I like to call the 40s no man's land, because at that point in time, all hell breaks loose, and hormones could be like every which way. You can have frequent periods, you could skip periods. There's lots of changes that happen. And then in menopause is when you start to see a lot of those shifts and a lot of that decline. I brought on this picture. This is from the Quantum Biology Collective. And quantum biology, it's the study of light and magnetism and mitochondrial health. But I really loved this picture so much because it alludes to what I talked about at the beginning, about how the way that these hormonal chemical messengers in your body are eliciting themselves, it's happening at different times of the day. And you can see here, it mentions changes in your body temperature, the time of day that you're going to get the deepest sleep. What time would that be? Right? 2. Yep. When do you start producing melatonin? Now, these aren't perfect times, but they're roundabout times for when we should, consider that these things are happening. And so I really love this diagram because it reminds me of how that first statement at the beginning, hormones have their own circadian rhythm. And so this is why it is so important for us to really honor that and support how well we sleep and the time of day that we're sleeping or the time of night, making sure that we're getting as much deep, rich, good quality sleep as much as possible. And then that we're stepping outside at 12 noon throughout the day, that we're getting that natural light. I mentioned last week, 90% of us are inside too much, right? 90% of the time. So ideally, we want to make sure that we get outside as much as we can in daylight hours to remind our bodies. We're trying to literally remind our bodies that I want my body's circadian rhythm to align. I want certain hormones to produce themselves and elicit really great responses at certain times of day. Here's a close-up of the picture. And what I love about it is, look here. I didn't mention this earlier. Intestinal movement stops, or it's supposed to. It's supposed to stop. And it doesn't stop entirely, but things just start to slow down. So ideally, should we be eating meals and digesting food at this time of day? The answer is no, because our body wants to produce melatonin and support sleep. It really wants to be in a nice, restored, relaxed, restful state so that we can charge our battery, get rid of bad cells, focus on recycling what we need to, etc. Lots of hormones can decrease in production when we age. So, this particular research study shows us that even how well you produce insulin hormone from the pancreas is impacted by aging. And you actually see when you look at this busy diagram, focus here, focus on this particular part, and it shows you that your blood sugar metabolism goes down as you age. Here it's premenopausal, here is perimenopausal and postmenopause. So women that have no period for 12 months, that's when they consider you to be in menopause. And throughout this time period, look at what happens to the blood sugar regulation. It starts to go down. Even your immune system and how well your immune system is able to respond to things also starts to go down. So there are certain hormones that are absolutely affected with aging, and there's evidence of that in the research. Melatonin production, how this decreases with age. This one's near and dear to me because I think you all got the newsletter from the last one where I gave you more of a breakdown on melatonin and the science behind it. And what we know is that it's not just about sleep. It's about healing, it's about repair, it's about getting rid of cancer cells, it's about decreasing inflammation, it's about balancing out the stress response. So there are so many important things with melatonin, and as we get older, our brain's ability to stimulate and produce enough of it starts to go down. And you'll often see that people notice that too. They're not sleeping as much, they're not sleeping as deep, not as restorative and restful, etc. Thyroid function. Here's that thyroid gland in the neck that supports your body's metabolism, thermoregulation. And whenever people ask about symptoms of a sluggish thyroid, the short list, there's a long list. But the short list is weight gain, sluggish thyroid, cold intolerance, feeling cold all the time in rooms, and you look around and everybody else is not wearing bundles like you. Hair thinning and shedding more than usual. Mood changes, anxiety, depression, irritability, etc. And nail changes. You'll often see that. And then the last one is fatigue. People are super tired whenever that thyroid is sluggish. The other important thing to remember is that all of these hormones that your body is creating, they work together. There's a symphony between them. And so none of these hormones work in a vacuum. They all work together. So if the thyroid isn't working well, guess what? Those adrenal glands are probably not working well either. And then if this thyroid gland isn't working well, then the ovaries are probably not getting the right messages either. And that's one thing that we need to acknowledge that a lot of doctors miss the boat on, is that hormones don't work in a vacuum. It's not just the sex hormones and that's all we got to worry about. We want to make sure that we're addressing and acknowledging the synergy between all of them. The adrenal glands. This is our body's, we commonly call it the body's stress response. And in the very beginning, when I showed you that article, the adrenal glands that sit on top of the kidneys produce cortisol. They also produce DHEA. So interestingly enough, some of those sex hormones that we think are just produced by the ovaries and testes are also produced by the adrenal glands. And we forget how important that is, that it's not just about cortisol and the stress response, it's also how well your body can make the rest of the sex hormones. And that's the reason why it's so important. So at Luminescence, Sarah Gottfried, she talked about Menopause 3.0, about a vision for a time where women feel open about having these kinds of conversations about transitions that are happening in their life. That they're open about learning about new treatments or different kinds of treatments that are available to them, and educating themselves on things like estrogen metabolism. So a big part of that for me, especially when we talk about it next week with Dr. Evans, is to talk about that, because estrogen metabolism is something that even most hormone doctors aren't educating their patients enough about, and I want to make sure that you all are very much aware of what that means. Now that I'm winding down, I think of what can we do about our hormones and hormone health as we age. And this is just a short list, but it's a fun list of lots of different things that as you're kind of walking through everything, it's reminding you of things that you need to do. I put get labs drawn because you can't tell you how many people aren't getting their blood work to give us some basic foundational information about where things are. And it's never like you just trust the labs. We're talking to women about labs and symptoms and their story and when a lot of these things started to happen. And one of the common questions that we ask at Love.Life is, when was the last time that you felt well? And you'd be surprised because it'll bring people to tears when they think about the last time that they felt really good because things have been so bad for so many years. The other thing you can see here, let me pick a couple of them. Take inventory. First things that we think about with hormone health and whether or not people are paying attention is, how do you really feel? Do you have any symptoms? Or maybe you have nothing and you don't have any symptoms at all. How well are you sleeping? What's your energy like? How do you eat? Do you notice that there's periods of times where you're absolutely not hungry or skipping meals? When's the last time you worked out? What about the last time that you drank a glass of water? Something as simple as that. Because for a lot of people, when they think about it, they're like, am I really paying attention to a lot of these self-care modalities and tools and habits that can be supportive of my health and my hormones? Now, I put hormones on here because the first thing people ask is it for me? Should I be taking them? Should I not? What about the birth control that I took in my 20s? Is that something that affects me? And so that part of the conversation, we're gonna dig deep and roll up our sleeves and turn off the video so that we can have some honest conversations about hormone health in the next couple of sessions. Herbs and nutrients. I always like to think of supplements as being supplemental, but we live in a world where a lot of things that we eat, even things that are organic, they don't have the same nutrient profiles that they used to. And so because of that, there are instances where supplements can be super helpful to help optimize and get things in a better place. I always think that instead of grabbing every bottle from the next influencer that you see. Talk to your doctor about it so that you can even really see, does this even apply to me? Because you think it applies, and then you talk to your doctor about it, and they're like, well, not so sure that really applies. I also think that too many of us are just falling for those traps, myself included. And I think it's important that we take a step back. It's almost like you want to Marie Kondo your supplement cabinet and literally like, okay, let me put everything out. Let me just like look at all of this. Let me decide, should I even be taking this or not? Let me talk to my doctor. Let me show them. And people do bring in all of their bottles or pictures of everything so that we can go through it together. Not a fun, but a funny story is recently a patient came in, and when she brought all of her bottles, there were like 7 antioxidants in the supplement, like the table. And nobody should be taking that many because oxidative stress serves a purpose in the body. So I think it's really important for people to talk to their doctor about it so that they're not duplicating and triplicating or quadruplicating on things that they might not really even need. And we have to trust our bodies, right? We can't just focus on a supplement cereal every single day because there are so many other important things that we can be doing to support us beyond that. I brought this up as a little bit of a taste for some things that we'll talk about over the next couple of weeks. But there are different kinds of tests that are really helpful for people when they want to learn about hormones. And at Love.Life, we offer all of these in different ways. And it doesn't always apply to everybody. Sometimes it can apply that I'll want a patient, male or female, to get some of these things done. And some people just really love their data, and they love to learn about their bodies, and they want to do some of these tests. So the blood tests that we typically do, they run about 120 biomarkers. It does include a full hormone panel. When Anna and I sat down and we were thinking about what kinds of lab tests and markers are going to be important for everybody, we made sure to include not just the sex hormones, but full thyroid panels. We wanted to make sure that we were looking at the signals between the brain and the ovaries. We added a cortisol marker for the morning, and then, of course, the sex hormones. Now, I mention here the urine tests because I do believe that it's very important for women to look at how they metabolize the hormones, especially if they have a personal or family history of cancer, or they have other things going on that doctors haven't been able to figure out when it comes to women's health. When we do urine testing for hormones, this isn't the same as doing the blood tests. And so these tests in particular are looking at literal metabolites of estrogen. And why does that apply? Because when women don't know enough about how they metabolize estrogen, they could be creating inflammation. They could be causing their cells to be damaged. It also increases the risk of cancer. I did a lot of these tests myself, especially in my early 30s when I was going through my breast cancer journey. And I didn't have a lot of guidance on it. And so I needed to figure out what applied and what made sense. And I think that's why I'm such a strong advocate for people learning enough about their bodies as much as they need to. Because urine testing and looking at the hormones and looking at how your body metabolizes them is crucial, especially in those cases where there's a history of cancer, either personal or family history, or you're concerned about inflammation, or you're concerned about how and if your body feels as though you have damaged cells. And don't get me wrong, I love hormones. That's why I'm talking about them right now. But I think it's important for all of us to know how your body metabolizes them. The next is saliva tests. And you see saliva there at the bottom. It says, measures free unbound hormones that are available to tissues. The saliva testing, one of the most common tests is actually cortisol testing. And the most accurate way to look at somebody's rhythm of how they create the cortisol stress hormone is to look at the pattern throughout a day. And you can do saliva testing, that's the most accurate for that, to see what these patterns are doing in people's bodies. Some people, they want to see if their body is able to create enough of those adrenal hormones. And a test like that can be helpful because hormones are circadian. So it follows a very nice path. It follows a ski slope like a rhythm. And it can be helpful when you're trying to understand certain times of day of when to add certain supplements or when to add certain exercise modalities or even when to stop and focus more on sleep, etc. A lot of the at-home tests and I'm sure many people in this room have also fallen for that as well. What I'd say is, this is a choose your own adventure here, okay? When it comes to the at-home tests, because there's these great tests that are direct to consumer, and then you get the test done, whatever kind it is, whether it's stool or blood or urine or saliva, and then you get a 50-page report, and then you don't know what to do. And that happens to a lot of us, where you get this test done and you're not sure if it even applies. Maybe it costed you $300 or $500, and now you've got this report and you're like, okay, now what do I do? So instead of choosing your own adventure, get some guidance from your healthcare team so that you can decide for yourself, like, does this even really apply to me? Do I even need to be doing this test? How overwhelming is it to get a 70-page report and not really come up with tangible advice for what applies to you? So here's an example of how we treat hormonal issues at Love.Life. We have a really detailed health history report that goes all the way back to birth. And we did that for a reason, because as things happen throughout your life at different times of your life, there are certain patterns that can even start at birth, including if you were breast or bottle fed, if you struggled with issues in childhood, skin issues, immune issues, etc. And so that's why we took our intake process all the way back. And then we kind of walk through different decades of your life, and part of that conversation is to note different things that happen from a medical perspective that oftentimes are relevant. And even though you think, oh, that happened so long ago, you'd be surprised. Some of those little detective details for a doctor who's looking at root cause, that's where the gems are, that's where the pearls are. We also do the diagnostic laboratory testing in-house. So everything is done here at Love.Life. And if there happens to be any specialty testing, it is actually also given to you before you leave. So those are all things that are done right here. The other thing is, time to connect is a luxury, especially in the world of medicine for most doctors to have. And I think that I can speak for Anna and I, we're grateful for that. We get to spend time with our patients. There's no rushing the visits. We spend at least 60 minutes for the first couple of visits. We spend 30, if not more, for the follow-up visits. And our patients have access to unlimited messaging to be able to communicate with us directly. I always tell patients, too, that when they see us, especially for the first visit, that unlimited messaging portal, you'd be surprised how helpful that is. It doesn't have other members of the care team. It doesn't have the front desk gal. It doesn't have anybody who's helping with care navigation, because it's an intimate setting between you and your doctor to talk about your medical history and talk about health-related things. So even though our patients have access to different kinds of messaging with our team, they also have direct access to our doctors, and that's the way it should be. It shouldn't be that you're going through 5 people to get to your doctor. Another thing, listening. Step number 1, the entire first visit is just dedicated to learning your story. There's not a lot of interjecting. There's more asking thoughtful questions about things that have happened throughout the course of your life. And I think that's where a lot of the absorbing takes place. And then at visit number 2, that's when we roll up our sleeves and we talk more about the testing that you had and what applies and what the findings are and what next steps that you need to take. The movement plans that we have here are supported by different kinds of experts. We have something super fun called PT squared, where people see the personal trainer and then they're also seeing the physical therapist in one session. And every time I tell people that, they're like, I didn't even know that existed. But at Love.Life it does, where people can see 2 experts in one go. It mentions monitoring symptom relief, assessing menstrual health. This goes back to taking inventory, showing us what those patterns are and what your period cycles are like, what medications you're on or have been. And to be clear, we are board certified doctors, so that means if I felt that medications were part of our toolbox, they 100% can be. If I need to prescribe meds, absolutely we do. But I will tell you that 9 times out of 10, that's not the answer. And oftentimes there are so many other tools in our toolbox that we have here, including this entire 45,000 square foot facility. And because I have access to this, it's often not the answer. The next thing, emotional mental techniques for supporting health goals and stress relief. So we have a few fun things at Love.Life. The behavioral health therapist is a somatic healer in mind-body medicine. Her name is Karen. I love Karen because We saw a patient together, the two of us, and in that session, we both were able to provide dialogue, but it also gave me the opportunity to literally see her magic and how she was able to help this patient overcome some symptoms in just one session. So I really love that. Our other experts include Chinese medicine practitioners, and also we have energetic medicine with Kristen, so she does Reiki. And I think that's another thing I really love about Love.Life is that not many places have access to an expert care team that gets to meet together, that gets to talk together. And most of the time, people, if they are seeing any of those specialists and experts, they're going to lots of different places. They might go here for PT, and then they're seeing a trainer here, and then they're going to see their doctor and wait 3 hours to see them over there, etc. But we've built a community here and a foundation where we all feel supported with each other, and that's one of the things that I love about it. You can see it also mentions that referral for additional targeted therapies with Love.Life experts, it's part of the program. So for anybody who comes to see us, part of the program and part of their health journey is to engage with our experts, and they have access to a few credits there. And then the consistent follow-up. You normally are going to see a doctor once a year for 15 minutes, barely scratching the surface. They might do a very quick physical exam and send you on your way. But at Love.Life, it's more of a relationship. It's a partnership. So when people come to see us, it is not a top-down service. It's really a collaborative service where you have access to these experts who are also talking together, and then you yourself are advocating and collaborating with your doctor. So I do really love what we're creating. Some of my favorite women's health and hormone experts, some of which I've met personally throughout the years, and they are such lovely women. I love to celebrate other women who are doing incredible jobs, and a few tidbits and a few pieces. I remember talking to Dr. Carrie Jones at one of the conferences about one of my hormone patients, and she took the time to help me figure out what was the best thing I needed to do for her. Dr. Mindy was on the stage with Robin Berzin at Luminescence, and she was very much, just 2 weeks ago, talking about how women need to advocate for themselves. And if you're not happy with your doctor, find a doctor who cares about you, and don't just settle, and don't just stick to that. So I really loved her powerful message there. Felice Gersh has also been very popular and very supportive in the PCOS space. So for women who are struggling with PCOS, there is so much knowledge to be had there. Jolene Brighton, one of the more common books that she first put out, she put out one recently, but one of the first ones was Beyond the Pill. And I was recommending that like wildfire to anybody who had ever been on birth control because I wanted them to understand it. And I wanted them to be fully informed. And you can only do so much as a practitioner, but people have taken it a step further to offer some incredible education and thought leadership. So this is my short list of women that I really do love and appreciate and respect. Sarah Gottfried is the one I mentioned earlier. We are going to talk about that concept of medicine, of menopause 3.0, because it does need to be reimagined. There is a certain way that people should learn about their bodies, especially those of us transitioning in our 40s into our 50s. And then here's where you can find me. So I always think of my Instagram as a scrapbook because my mama still looks at it. And so I just like to show her things that I'm doing and fun stuff and podcasts and you name it. And so it's just a fun avenue for me. I don't treat it like a business. I really just put fun stuff that happens. And it's great. It's just, a little something that I put out into the world beyond seeing patients. Recently, I did a podcast with Julie Foucher, and her podcast is Pursuing Health. She was recently named one of the top 20 women's health podcasts from The Good Trade in an article that they just released. So I put this one on here, and what was cool about it was that as a podcast host, she actually came to Love.Life, and she got to experience it herself, and we recorded that episode right here. Another fun thing is she's been running her podcast for 10 years, and so it was episode number 310, and I was like, oh my God, that's a lot of podcast episodes. But It was a really great conversation. She was very much interested in learning about why people do what they do. And so she kind of took it back for me down memory lane about my breast cancer journey, about why I got into medicine, et cetera. And so she kind of, asked some of those questions. And it was also a no-filter conversation. There was no prep. There was no, like, here's the bullet points, nothing like that. It was just a casual conversation between two gals. So if you're interested, you're also welcome to take a look at Julie's podcast. She has a lot of really great interviews there. March 1st, I'm going to be at Woman in Bloom, and will likely be at the SoCal Wellness event as well. There are some interesting speakers at the Women in Bloom event. It's going to be at the Westlake Village. It's a full-day affair. It is a full day of women's health, financial health. There's other thought leaders that have different topics. I'm focusing in with Dr. Rajinder Raj on longevity. So that is more of a fireside chat experience. But when I Googled this place, I have never been to Westlake Village, that location, and it looks incredible. It looks like it's going to be a full day of just nourishing your body in every way. And so final thoughts. When you look at health throughout the spectrum, when you're looking at women's health, remind yourself, checkups, checking your breasts, taking inventory of your symptoms, finding a doctor who cares about you, one who you can trust, one who you're not afraid to ask questions for. And I also think that as we continue this conversation, we're going to learn a lot about each other in the next couple of weeks, because we have some intense conversations that are going to happen, especially for the next two in particular. Last thing I'd say about women's health through the ages is that while there are natural things from a hormone perspective that happen, it doesn't mean that we can't learn about why, that we can't acknowledge that it's happening, and that we can't check ourselves regardless of what age we're at. Whether you're 20, or you're 60, or you're 70, or you're 80 like my mom, it's still important for us to take inventory, that we can still focus on prevention, and there's things that we can do to better our situation, especially if we're experiencing a lot of stuff. Now, Menopause 3.0 on the 19th, hormone replacement therapy. If there are men in the room, we will talk about men's hormones as well. Who knows how many we'll get. It's commonly a female topic. Breakthroughs in pain management, melatonin, vitamin D, and sleep, doing a deeper dive into that. And then I feel like did I save the best for last when we talk about gut health and metabolism? So I feel like that might have been the best thing. Again, that's where you can find me. You'll also see a lot of activity from our team at the official Love.Life. And that is it for me. And I can't wait for this open conversation of topics and questions. So I'm going to stop talking for a minute and allow us to just kind of situate ourselves. Or maybe it's just me. Okay, yeah.